And welcome back. Now, the Africa Centers for Disease Control say that across the continent, 2/3 of citizens have expressed willingness to accept COVID-19 vaccines. And this was revealed as part of the findings of a report that was released by the Partnership for Evidence-Based Response to COVID-19 Consortium, or PERC. And there are also concerns that if the pandemic is not properly managed, then a third wave on the continent would prove deadlier. And the Africa CDC is also quoted as saying that there have been about 98% rise in cases in East Africa. And to tell us more about this, I'm joined now by Dr Emmanuel Agogo, who is the Nigerian country representative for the Resolve to Save Lives, or RTSL. And he joins me now from the capital, Abuja. Thanks so much for your time this morning. Welcome to Morning Live, Dr Agogo.
Good morning.
So firstly, with this pandemic, I think many of us have been very inward looking first and foremost to deal with it at the base that we are at. But of course, there is a bigger picture to speak to. Are you able to give us the latest COVID-19 figures for the rest of the continent at this point? How many cases, deaths, vaccinations reported to date?
So, in terms of the vaccinations, we know that there's been a rollout of vaccines in the majority of African countries. That's across the Africa subcontinent is currently just above 100,000. So the Africa CDC reports that about 111,318 deaths have occurred across Africa. Majority of these deaths have occurred, really. There's quite a difference in terms of where these deaths have occurred. In terms of recoveries, we have about 3.7 million recoveries. But in terms of cases, we have a report of about just over 4.1 million cases. Of course, we need to take these figures into consideration because of the levels of testing that are happening across the continent. And in terms of tests conducted, over just under 40 million tests have been conducted across Africa. We must commend the continent, though, that remember at the commencement of the outbreak of the pandemic, there was very limited testing capacity, PCR capacity across the continent. This was rapidly scaled up. And overall, African countries, have done reasonably well, both due to the response in the countries, as well as due to the demographics and other reasons which we are still trying to understand.
To the point you make, though, about testing, how reliable would you say the statistics that we are getting from across the continent are at this point?
Well, I don't think across, any region of the world can say 100% that, the statistics they have in terms of numbers of cases is 100%, because there are huge numbers of asymptomatic cases. There are also significant numbers of people who may not have access to testing. However, in fact, even in Nigeria, even though we reporting a recent study, a serological study, has shown that in some cities, in Lagos particularly, the serology showed where you check for infection, which might be asymptomatic, showed that about 1 in 4 people may have been exposed. So I would say we will continue to take the figures into consideration, just because of access to testing has not been as widespread as we would want. However, it does shows us that this is a problem that we all need to identify and work on. Still.
And we are at that point now where the vaccination processes have taken center stage. Let's take a look at the Perk Survey, saying that 2/3 of people on the continent actually want to be vaccinated. And as we understand it, most of the surveys conducted were done telephonically. So what were some of the sentiments that you gathered from the participants about the vaccine and vaccination processes?
So the PERC study, there's a Partnership for Evidence-Based Response to COVID-19. It was set up by a consortium of partners, including Resolve to Save Lives, the WHO, the London School of Tropical Medicine, Ipsos, and quite a few others. And essentially, this is the third wave of data that's been collected since the beginning. And initially, the focus was on public health, social measures. But this time, there's been a component looking at vaccine acceptability. And across the continent, just like you mentioned, about 3 out of 4 people have accepted that they are likely to take the vaccine when it becomes available. In South Africa and Nigeria, the numbers are quite comparable. However, this estimation varies from 90% in some countries, like Egypt, to less than 30% in other countries like Tunisia and so on. And therefore, but largely, many countries have many individuals who've been asked, they say that they will access the vaccine. Among those who say they will not access the vaccine, who are willing to take the vaccine, there was also questions asked about why were they unlikely to take it. So various reasons were given. Some people said that they are worried about not having sufficient information. Others felt that they were, had a very low risk perception, so they felt that they were at low risk of having COVID-19 or adverse outcomes from it. And then, of course, the other informations and disinformation that have been around in terms of, threats to Africans from the vaccine, as well as, conspiracy theories. Some of those were reasons why people say they wouldn't access the vaccines.
Professor Agogo, as we understand it, there were varying sentiments in different countries regarding getting vaccinated. For example, some low readings from Cameroon and Tunisia at around 35% of respondents, and then you take a country like Morocco, where the reading was as high as 91%. So what are the sentiments around the vaccine process, and why is it so low in Cameroon and Tunisia compared to the greater willingness in a country like Morocco?
So again, there's been the questions that were asked, like I said earlier, tried to explore what were the common reasons why many of these individuals felt that they would not take the vaccine. I would like to take us back to the idea, of course, that there's been a huge amount of misinformation with regards to COVID-19. Many countries, as you know, have suffered, maybe for the lack of a better word, situations where governments have become very politicized the process of managing COVID-19. Many of these have led to a lot of distrust of governments, and the fact that you've had social upheavals in many countries, and that has been a huge factor in terms of whether people actually trust the handling of it. In terms of Cameroon, particularly, when the risk perception in Cameroon in terms of whether they felt at risk, the risk perception was quite low. Only about less than 50% of the people felt that they were at risk of COVID-19. And this is even less than, the numbers we had across the West African sub-region. And in terms of vaccination as well, like I said, around 35% of them said they will not get the vaccine, and it was the same whether you were in rural or urban centers. And the general reasons in Cameroon were that they felt the vaccines were going to give them the infection. They felt that they did not have enough information about the vaccine. That's about 30%, and a few of them, actually about 20% of people, actually said that they don't believe that the virus exists. In other countries, like you talked about, Tunisia, where the response was also poor. Even though we recall that there was a very huge, in North Africa at the beginning of the pandemic, you had quite a lot of deaths at the time with the high case fatality at the time. The case fatality in Tunisia is one of the highest. It's still about reported at about 3.4%. And in Tunisia, one of the other things that is critical compared to many other African countries was that the people who they trust there are not the healthcare workers, unlike Nigeria, where the WHO and the Ministry of Health were trusted, or in South Africa, where the family doctors were trusted. In Tunisia, the institutions people trusted are the military and the community health workers, and the doctors come last. And in that country, the reason why people generally said, that they felt that the vaccines will not, they will not take the vaccine was really the same information around not having enough information and feeling at low risk and not trusting the healthcare providers. So it just leads to the fact that as a continent, we need to do more in terms of health information. We need to do more in terms of providing information about the vaccine. We need to be clearer about, the risks. And we know from the data so far that the people who are dying from COVID-19, even in Africa, are elderly, are those with comorbidities, with hypertension, diabetes, many who are undiagnosed, and many with chronic diseases like cancer and so on. So we need to, make out early. And healthcare workers are particularly at risk. So we need to make sure they're proper.
Dr. Agogo, we're out of time. My colleague Valen standing by with the sport, but I just want to squeeze in this one question. The European Union has had several concerns about the AstraZeneca vaccines causing blood clots. What does the Africa CDC have to say about the various vaccines available regarding this concern expressed by the EU, and also Johnson & Johnson's vaccine, Moderna, the Pfizer, all of those? What do you think works best for Africa at this stage, as briefly as possible?
Well, I can't speak for Africa CDC because I don't work for them, but as an African and as a healthcare expert, the fact is that the incidents that were reported in Europe happened in a population that is at risk of those problems anyway, because those who've been prioritized for vaccination are doctors and those with comorbidities, and therefore it's a catch-22. But one of the things that is clear is that for all these vaccines, there is a pharmacovigilance system that needs to be put in place and is being put in place, so that going forward, if there are side effects from the vaccine, either side effects that are coincidental or some that are causative, that we can track, find out, and make and intervene. But remember that the WHO has discounted that the concerns around the AstraZeneca, and we know that a lot of the countries that rolled back have brought it back on stream, and further data is being evaluated as we go forward. It's unprecedented times, unfortunately, and that's why there are drastic measures being put in place in terms of speeding up the time to make the vaccine while making sure that safety and quality is maintained.
Dr. Agogo, thanks so much for your time. Dr. Emmanuel Agogo is the Nigeria country representative for the Resolve to Save Lives, or RTSL, talking to us about a survey that they did, the Africa Centers for Disease Control, saying 2/3 of people on the continent are actually willing to take COVID-19 vaccines. Let's hand you over now to Valen with some sports news.